I want to talk today about heel pain that just won't go away, and particularly plantar fasciitis. Now, first, this isn't a video on the general treatment of plantar fasciitis. Really want to focus on plantar fasciitis that's just not getting better. Now, the most common reason for this is a condition called plantar fasciosis. In fact, most plantar fasciitis, itis means inflammation, most what we call plantar fasciitis is not plantar fasciitis, but rather a thickening of the plantar fascia. So here is the plantar fascia as it attaches into the heel. Where it attaches in the heel here is normally about 4 millimeters thick. Now, if you have plantar fasciitis, in general, the first month or so, you do have that inflammatory response. But after that, you get somewhat of a degeneration. Almost think of it as a scarring of the plantar fascia. And this ligament becomes thicker and thicker and thicker. And if we see that as above 6 millimeters thick, again, the normal is about 4 millimeters, then we have a diagnosis of plantar fasciosis. And we measure this with an ultrasound machine. Now, if it is plantar fasciosis, or rather than plantar fasciitis, doing the standard anti-inflammatory measures tends not to be very effective. In this situation, we have to somehow stimulate the healing of the tissue. So one way to look at plantar fasciosis it is simply a ligament that no longer is healing. It has stalled the healing process, and somehow we have to start this again. And there's different methods to do this. These are all focused on, again, trying to get that healing process to start again. The treatment that has the best studies behind it is something called Shockwave Therapy. We use a machine that, for lack of better terminology, feels like a small jackhammer on the bottom of the heel that sends pressure waves through that tissue. And it causes, from a physiologic standpoint, release of what are called growth factors and formation of new blood vessels, something called neovascularization. And that helps stimulate a healing process. So when we treat this, as you'll see on the other videos and elsewhere on the website, first thing we want to do is get load off of that tissue. We might use an orthotic device of some sort to get load off the tissue. Then we want to stimulate the healing of that tissue through shockwave therapy. And there's a couple other different ways that we can do that also. For more information on that, go to the website and do a search on chronic heel pain. And we'll have a whole list of different methods that are available to try and treat that heel pain that just will not go away.